Hi everybody, in this video we're talking about how to exercise your shoulder when it hurts to move. Specifically, we're going to do 8 exercises for the shoulder that do not require you to lift your arm. Welcome to the Health How To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips that you found to be helpful for getting rid of your shoulder pain so that we can all benefit in our own personal journey to better health. Why do we get shoulder pain in the first place? Well, there are many reasons, and in this video we are specifically addressing shoulder strains, sprains, arthritis, impingement, rotator cuff tears, and other injuries. There are some factors that you can't control when it comes to shoulder pain: the shape of your bones and the quality of your tendons and your age. For example, you may have a type of acromion that is thicker and can pinch more readily onto the soft tissues like muscle, ligaments, and bursa of your shoulder. Or your tendons could have permanent scarring or tears. And unfortunately, your shoulder repair and recovery process generally becomes slower after the age of 40. Shoulder-related pain complaints increase with age, especially into the 60s. But what about some good news? There are 5 other main reasons for shoulder pain that you can control. Number 1, weak muscles of the shoulder, neck, and/or upper back. Number 2, tight shoulders, neck, and/or upper back muscles. Number 3, having shoulders that are rolled or scrunched forwards. Number 4, having poor control or poor movement patterns of your shoulder blade and shoulder joint during everyday activities. And number 5, a tendency to be slouched forwards in standing and sitting. So you can see that there are things that you have a fair amount of control over that directly affect your shoulder pain and recovery. Number 1, how much muscle you can build. Number 2, how much flexibility you have. Number 3, how your shoulder is positioned. Number 4, how you move your shoulder. And number 5, your posture. Will it be easy? No. Can you just do the exercises sporadically and hope for the best? Also no. How about shoulder surgery? It may surprise you, but having a rotator cuff tear is not an indication or a deciding factor for a shoulder surgery. You should really only consider surgery if you have put major time and consistent effort into a conservative shoulder rehabilitation program. It is common for shoulder physio rehab to take anywhere from 3 to 12 months. And finally, we come to the real reason for this video. Know that you should be exercising your shoulder, but it hurts too much to move your arm. These 8 exercises will help you get started in your shoulder injury rehabilitation, especially in the early stages of shoulder pain, where it hurts nonstop and you can't get a good night's sleep. Although you can do all 8 in a row, ideally you should spread them out from morning to night so that your shoulder doesn't get a chance to stiffen up. For more tips on how to fix your shoulder pain, check out some of our other shoulder pain videos. Ready? Let's get started. Number 1, shoulder roll. Shoulder rolls help to get your shoulder blades and shoulder girdle muscles moving. They help to increase the blood flow to the muscles, and better blood flow means more nutrients and energy for tissue repair, and more of the waste products out. Roll your shoulder up, back, and down in large circular movements. Take deep belly breaths and exhale through your mouth to get true muscle relaxation. Repeat 10 to 30 times. Number 2, chin tuck. Chin tucks help to align and straighten your neck and lessen the constant pull and pressure through the discs of your neck. If you have the tendency to keep your chin poked out, like while you look down at your phone or laptop or while driving, the front of your chest and shoulder muscles can shorten over time, leading to poor shoulder movement patterns and a gradual wearing away of the rotator cuff tendons. Pull your head back as if you're making a double chin. Hold your head level. Hold for 5 deep breaths and repeat 10 times. get into the habit of doing this chin tuck exercise while using your devices. Number 3, thoracic extension. If your upper back is stiff or hunched, your arm will have a tough time reaching all the way up towards the ceiling without some pinching on the shoulder. A low level of compression can even occur if you have the habit of slouching over at your desk and using the mouse a lot, or more commonly, slouched over while looking down at your phone. This exercise basically involves bringing your chest up to the ceiling and bending your upper back backwards as you look up. Again, coordinate this with 3 deep breaths. Repeat 10 times. Number 4, steering wheel pull apart and pull back. These 2 exercises are great if you drive a lot. After a while, we tend to slouch and keep our chin poked out. Do this exercise when you get to a stop sign or red light. Keep your elbows by your side and put your hands at the 3 o'clock and 9 o'clock position. Try to pull the steering wheel apart and hold for 3 deep breaths. Then pull back on the steering wheel, keeping your shoulder blades flat on your back and chest up. Again, hold for 3 deep breaths. Number 5, pendulum. Okay, so the pendulum does need you to move your arm, but it really does feel good when you do, because if you do the pendulum exercise correctly, you're not actually using any muscle power or lifting your arm up against gravity. Start by leaning over a desk or wall so that you are almost bent over to 90 degrees. Use your good arm for support. Then let the bad arm dangle to the ground and pretend that it is a pendulum. Swing it freely with larger and larger movement forwards and backwards 10 times, side to side 10 times, clockwise 10 times, and finally counterclockwise 10 times. Don't clench your fist or force the movement. This exercise is particularly helpful when your shoulder pain wakes you up in the middle of the night. Often doing the pendulum exercise can loosen the shoulder joint up so that you can get back to some much needed rest. Number 6, lying on your back. This is one of the best non-exercise exercises because all you do is lie flat on your back with your palms up. The point of this exercise is to take the pressure off your discs and to straighten out your neck, upper back, and shoulders. Now, sometimes lying on your back can really hurt when you have severe shoulder pain. So you can roll up a little hand towel and place it lengthwise behind your shoulder until lying flat becomes more comfortable. The next 2 exercises can be done at your desk or kitchen table. Number 7, chair pushback. Keep your arms by your side and elbows bent to 90 degrees. Press back on the back of your chair with the back of your arms. Hold for 3 deep breaths. Remember to keep your chest up. And number 8, elbow push down. Put your elbows on the table, hands facing the ceiling. Use your elbows to push down, pull the chest up, and look up at the same time. Hold for 3 deep breaths. You should feel a downwards pull on the shoulder joint as well as a nice chest stretch. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.